Hi there, welcome, and I'm so glad you could join us. Well, for the first video in this series, I'm going to introduce you to an interesting new medical paradigm. It's a totally new medical model that I was very pleased to come across and join up with in the late 60s, early 70s. It really is a revolutionary paradigm of healing, and we'll see how that goes, how that works. It's based upon an important new principle. Well, it's not a new principle, it's the oldest principle there is. But it's a new idea to medical science. It's the idea that nature heals. Mankind doesn't heal, and especially doctors don't heal things. In fact, they often complicate things, but they certainly don't really heal. If you think about it, it's nature that heals. You know, if you break a leg, it's nature that heals that, not the orthopedic surgeon. If you cut yourself with a knife, as long as you hold the sides of the wound together, nature will fix it in no time, often when you can't even see a scar. So really, this principle boils down to the fact that you just need to get rid of anything that's blocking the healing process, and then just stand back, get out of the way, as it were. In this way of thinking, we don't see the body as busted. I mean, the body is a self-organizing, self-healing system, basically. It's a very intelligent and very capable self-organizing system, and it's capable of doing almost magic, except that it's not really magic. I mean, my definition of magic is there's no process. You know, if you don't know the process, it's either magic or looks magic. But once you know the process, you know, like radio waves, it looks like magic until you know the process and how it works. Once you understand radio waves, the whole thing becomes very simple. So basically this talk is about comparing the sort of old view and the new view. And I should clear up this point right here, which is it's a bit of a misnomer. What I'm calling the new view is really the old view, or the very old view, you know, that goes back beyond modern medical science. But modern medical science has got itself into a very arrogant position. It's very entrenched. It doesn't move. It's not really interested in learning and moving forward. And that's now become, if you like, the old view. And what I'm talking about, and what I shall refer to as the new view, is very traditional in many ways. It's been around a long time. You know, modern medical science is the new kid on the block, and it's very full of itself, but it simply isn't justifying, with the results it gets, the extraordinary prestige position it likes to occupy. So, as I say, maybe not new, maybe an old principle. We certainly do have new insights. You know, we're not just relying on a medieval or a biblical view of things. We've learned a lot since then. So what I'm going to do is sort of help, you know, shed some light on this and share with you what I think is the magic of this new dimension of healing, the wonder of it. I'm going to compare step by step the old way and the new way. The old way says basically that we're busted. The body's broken in some way. It needs a doctor to patch it up. Of course, they don't really fix things. There's no real cure as such. They talk in terms of treatment. And their view of treatment is something that you will go on and on using. You know, there's very little concept of taking a remedy and then it's gone. I mean, one of my strong and controversial definitions of a cure is simply this, that the disease has gone away and the treatment's gone away. If you're taking treatment every day, that's not cured anything. And by definition, chronic medication isn't solving the problem. So, you know, there's an extraordinary amount of arrogance in the medical profession that's definitely they're not entitled to it. Now, the new way of looking at things says, well, nature will fix it. It just, you know, given the right circumstances, if healing isn't taking place in any rapid way, it's not solving itself when you think it should. It's simply that something is hidden. There's something not in view. Some impediment is in place. And also, if you think about it logically, the main thing that's in place is the thing that's causing it. If you go back far enough to a cause, there's a reason for the person having a disease or a symptom. If you go back far enough and take away the cause, then you'd expect a healing, wouldn't you? So, I mean, if the problem's still there, the real cause hasn't been found. I mean, duh, you know, I mean, how simple is that? So it's very logical, this new approach, a new way of looking at things. I'm going to use a couple of big fancy words. These come from my old mentor, Ted Randolph, a wonderful humanitarian, skilled doctor. And he was really one of the original breakthrough pioneers in this field. I just kind of hung on to his coattails, really, for the ride. I learned a lot, trust me, an amazing person. And he liked big words once in a while. And he introduced this concept of endogenous-based medicine or exogenous-based. Now, endo just means on the inside. Okay, so the endogenous view of medicine is it's all problems from within. And if there is a problem, therefore, clearly something is busted or something is wrong. It's kind of condemnatory in a way. Whereas the exogenous view is that the body's okay. You know, nature knows what to do, but there's something from the outside that's impinging or impacting. And that something could be a virus, a food allergy, some kind of stress, chemical overload, but it's not inherently the body, because if you take away this exogenous factor, then healing takes place. See the difference? A different way of looking at things completely. And I'm going to run these 2 or 3 ideas past you side by side and compare and contrast the differences. Okay? First of all, the endogenous view, that's the orthodox doctors, the reductionist view, the mechanistic view, it's the body as a machine view. There's no space for spirit and mind and creativity and natural energies. All that's the exogenous type of medicine, the new paradigm. The endogenous system treats everyone as average. Now you'll hear me say lots of times there's no such thing as an average person. There are averages. You can average anything. You can average height, you can take an average weight, you can take an average life expectancy. But nobody has all of these characters. Maybe 0.25% of people come close to having many of the average characteristics, but the vast majority don't come anywhere near. A hypothetical patient is, an average patient is purely hypothetical. So it doesn't even exist. So they're treating a non-existent form of human being. The way we do things, we look at everyone as an individual, and the first thing that strikes you is we're all different. Nobody walking the streets or driving a car down the highway is average. You can see by their hair, their clothes they wear, the way they move, their height, their weight, their attitudes. Everything they say, do, think and represent is different. There are no 2 people really alike. So that's a very important contrasting difference. And of course, it's important when it comes to healing, because it means there's no one solution that fits everybody. That's what's wrong with drug medicine. They think one drug will fix it for everybody. And not only that, but the average dose for the average person that doesn't exist will fix it for everybody. You see, it's totally crazy. Basically, the endogenous medical system is kind of blaming the patient. It's the patient's fault. The patient is screwed up. The patient is busted. Some bits dropped off or some bits broken. Whereas we look at exterior things and blame those. We blame pesticides and pollutants for the person's asthma or headaches and migraines or whatever it is. Endogenous medicine is very symptom-oriented. It's obsessed with symptoms. All diseases are categorized by symptoms. In other words, what do you see? Is it a rash? Is there a headache? Do you get bellyache? Is there diarrhea? And they don't look for causes, whereas we class things by causes, like a food overload, a hidden infection, a chemical pollution. These are causes, so we're very cause-oriented, and that's another major difference between the 2 systems. Like I said, endogenous medicine is seeing averages, not seeing uniqueness, which is what we see. Their view is that you override nature for the cure. Nature is no good. She can't handle this. We are cleverer than nature. And oh yes, you'll be surprised, but that kind of arrogance comes up over and over again with orthodox doctors, regular doctors and regular medical science. We actually try to enlist nature for helping curing. We believe she can do the job given the right circumstances. And I said the only thing that can really stop natural healing is something in the way. So if you want to be a very smart diagnostician, figure out what the something in the way is and remove it. Never mind giving fancy labels as a so-called diagnosis. I mean, just as an example, irritable bowel syndrome. That sounds like a diagnosis, doesn't it? It's not, it's a symptom. I keep joking with people. It's a symptom, it's not a disease, it's a symptom. The person, it's like someone goes to the doctor and said, oh, I've got a jippy tummy and pains. And the doctor says, I know what's wrong with you, you have a jippy tummy and pains. But he says it in Latin, you know. He calls it irritable bowel syndrome. It just sounds, it's exactly the same thing as the patient said, but in different words. Now here's a big difference, which is that the orthodox medical approach really tends to add to the burden. You know, they stress up the patient, they use chemical remedies, they call them drugs, but they're often themselves quite toxic. A lot of people in overload situations, even without knowing it, are chemically sensitive. We're all chemically overloaded. You know, the idea of the human canary. In the old days, they sent a canary down the mine, and if the canary got sick, they knew it wasn't good for humans. 20, 30 years ago, we used to talk about human canaries. You know, they were getting sick, giving us the warning. Listen, in this day and age, I don't think even that metaphor works anymore. We're all being poisoned. You know, there are Eskimo mamas right up in the Arctic feeding their babies breast milk that are loaded with toxins of all kinds. You know, as remote as you can get. So we're all overburdened in that sense. So if you want to get a healing or get a cure, you need to reduce the burden. You don't need to add to the problem. You need to reduce the problem and reduce the overload factors. So that's an entirely new principle as well that goes along with this new medical model, this new paradigm, is reducing the body load or the body burden. Don't even worry about the symptoms, worry about the overload. If you reduce the overload, then the symptoms will usually resolve themselves. And I found that to be true in over 35 years of working clinical practice. It's almost magically true, except that, as I say, once you know the mechanism, it's not magic. But it does seem like we're in the face of magic when looking at nature. She is so awesome, so creative and so wonderful and so abundant and so inspiring. It makes you wonder why anybody has to be sick, really. It's not nature's way that we should be sick. And, you know, typical of animals in the wild and so on, it's pretty rare, actually. You know, most animals don't have sickness in the human sense. Most of it is self-inflicted due to bad diet, bad lifestyle, and so on. So listen, if you can reduce the burden so that there's more kind of room to maneuver, more leeway, however you want to think of it, then the normal defense mechanisms can take over and start to do their work. You know, we see cancer, for example, as probably an immune disease more than anything. The immune system isn't knocking off the rogue cancer cells. So if you do things that suppress your immune system, and we know that stress suppresses the immune system, we know that chemicals suppress the immune system, we know that sugar, for example, suppresses, you know, it slows down white cells and things, we know that mercury toxicity does so, then if you look at all these things, if you can remove elements like this in the person's surroundings, up comes the immune system, starts to do its job, and you get what appears to be a miracle recovery, or so-called spontaneous recovery from cancer. That's a very misleading idea, as you know, spontaneous recovery implies that there was no real reason, you know, it just happened. There's always a real reason, and when the person recovers, it's good for celebration, but don't kid yourself, it's just magic. There was a reason, there was a cause. Definitely what we don't need in this situation is alien substances. We can work with what's natural, and that's very satisfying to holistic doctors like me and holistic practitioners of all kinds. And remember, you know, in my panoply, I don't even want to include things like homeopathic remedies. You know, they're okay for temporary solutions, but they're not solutions in the long term. Remember what I said about a cure, you know, no disease, but no treatment either. All gone, no further need for that. So you have to find ways to reduce the body burden. And in this way, I stumbled across what I believe to be nature's #1 healing secret. You know, she can fix anything if you just reduce the burden. And here's an amazing, nice thing too, which is that we can start to think in terms of a cure. The person is well and will stay well, providing they keep away from the triggers. So let's take somebody who's got, say, migraines, and I trace that to, you know, an allergy to dairy products, say, or maybe, you know, tomatoes or something like that. The person gets well, That's a cure, providing the person stays away from the dairy products or the tomatoes. Or we can desensitize them so that those things don't react anymore. So they're okay now with those things. That's another mechanism we can use. But it amounts to the same thing. The person doesn't need any further treatment and they don't have any further problem. That's very satisfying, and the change that took place in my medical career and how I saw myself as a doctor in the 70s was quite an amazing transformation when I began to discover all of these truths for myself, okay? Now, the overload factors, they can be many and varied, and I've mentioned a few. I'm sure you can guess some and you can probably figure out some more. For example, stress, it's one of the most notorious overload things that there is. Anyone suffering stress is right in the pathway of disease and likely to get sick unless they can eliminate that stress element. Allergies and intolerances of all kinds, those are stressors. Chemical pollution, stressors. Drugs, remember, are just more chemical pollution. Doctors don't think of it that way, but you know, it's true. I mean, what doctor would say, well, I can see what's wrong with you. We have a treatment here. I'm going to chemically pollute you with this yellow pill. I just want you to take it. They wouldn't use that language because they're not thinking, but that's what they should be saying. You may have heard of geopathic stress. That's another kind of overload factor. The idea that there are dangerous spots on the Earth's surface that carry excessive and disordered radiation. Everyone knows about heavy metal toxicity, you know, lead poisoning, mercury poisoning, cadmium, arsenic and so on. Hidden infections, that's a big one that most doctors don't think about, you know, unless somebody smacks them right in the mouth and says, hey, they don't come across, nothing wakes them up to this idea. And by hidden infections, I mean parasites are possible, but also these stealth pathogens like funny viruses and bacteria that get in under the body's immune radar. They don't trigger an immune response, you know, like the military going under the radar. So nothing happens to throw them out. So they can get in there and thrive and hide, but they can do a huge amount of damage. Listen, just plain fatigue is a stress factor. You know, if you don't get enough sleep on a regular basis. You know, ask anyone who's working night shift or somebody who's cramming for exams, you know, they'll tell you. They start to feel pretty ill after enough nights with not enough sleep. Electromagnetic fields, you know, that's one that we're very aware of these days. I constantly joke that, you know, we all have the Tokyo Stock Exchange running through our bodies every day. And then we've got cell phones, so we clam to our head something that's emitting quite toxic emanations. These are certainly part of the overload factor. And that immediately brings to our mind another key principle here, which is it doesn't matter what the overload factor is, that what results depends on what part of the body is affected. And we call this the target organ. You may also hear it called the shock organ, or end organ failure is the kind of posh way of putting it. It simply means the symptoms relate to which part of the body breaks down. So if it affects the skin, you get a rash, and so on. If it affects the heart, you might get a speeded heart or an irregular heart or coronary artery spasm or something like that. So as I say, it doesn't depend on the stressor. You know, you can take a person who's intolerant of milk, and one person will get colitis, another person will get a rash, another person gets a migraine, another person gets asthma, a kiddie goes into behavioral disorders and ADD. The trigger was the same for all, but the end organs were different in each case, do you see? So the best way to think of the target organ or shock organ is the weakest link. It's the sort of weakest part of the body that gets hammered. We can produce diagrams like this. You'll see this in more detail in some of the later videos in the Academy. But it just relates different symptoms to different organs. The joints, for example, can be stiff, they can be painful, red, inflamed. Skin, it can be eczema, urticaria, which is hives. And in the lungs, you get asthma. Brain ones are very interesting. You can get almost, I shall be doing one of this about brain allergies in this introductory series. Totally fascinating, because the brain is the source of most of our feelings and perceptions anyway. So if you start screwing that up and making it feel a bit funny, the brain can imagine all kinds of symptoms, from weird and scary ones to some that are just very difficult to interpret unless you realize it's what we call a brain a brain allergy. Some of the classic places you meet allergy symptoms, of course, everyone knows the nose and the mouth passageways. You get catarrh, runny nose and sneezing. But you know, one of the things I've got to tell you is that it's often not something the person's breathing. That seems obvious, you know, the person sneezes, they have catarrh, so you think house dust, cat fur, you know, pollen if it's seasonal rhinitis. 80% of the time, more, actually, I would say, it's something the person's eating. You know, countless patients will drink a glass of milk, they'll sneeze, and you know, snot will begin to run from the nose, severe catarrh reactions, if you do the test right. And that's one of the things that I do share in the Academy, is how to do an extremely accurate food challenge test. Okay, so how can we reduce this body load? Well, really, that's what the Diet Wise Academy is all about. We concentrate on foods, but it's not uniquely and only foods. You can do all kinds of things. I mean, just eating better, and when I say better diet, I just mean, you know, cut out the junk and the fluff and the crap, the thing with colorings. The foods that we call vitiated foods. Vitiated is just a posh word meaning all the goodness taken out of it. And sometimes they claim they've enhanced it or fortified it by adding things back. But trust me, it's only a shadow of what it really should be. You can reduce stress. That's a great way to reduce body load. I'm on record with the BBC in England as saying divorce can be a great cure for allergy. It wasn't just a joke. You know, if you're living in an impossible relationship with an enormous burden of stress and you can't agree and neither partner can figure out how to resolve it, a divorce may simply be the solution to the, you know, the migraines, the colitis, the asthma, eczema, whatever it is. Listen, having more fun, you know, enjoying life, doing good things that are wonderful, that you love and enjoy, is a great way to reduce body load. You know, up go your serotonin levels, your dopamine sorts itself out. You feel good, you're feeling in a good place, and the body can start to heal almost immediately. Do you remember Norman Cousins' book, The Anatomy of an Illness? He laughed his way back to health. He had a terrible arthritis condition, and he put on funny movies and laughed and laughed and laughed till the condition went away. Don't think he even recorded changing his diet or anything like that. Better nutrition's obvious. You know, we need to nourish ourselves properly, and I'm talking particularly now about supplements. It's a tragedy and that most doctors are so ignorant they say you don't need to take supplements. If that was ever true, and I doubt if it ever was, it's going back 60 or 80 years, in the modern world we simply cannot cope with the overwhelming tsunami, the tidal wave of chemical and electromagnetic and other oxidative factors that we're meeting. If you don't help your body with enough antioxidants and nutrients to build up the defenses and detox pathways, you're going to end up in trouble. And I'm sorry, it's just a complete criminal lie to say we don't need nutritional supplements. They're just expensive urine. Clearing up hidden infections obviously suggests itself. You see, you know, I was talking about those stealth pathogens. You see, in this model of medicine, as soon as you diagnose a cause, then the cure instantly suggests itself. Oh, you have candida. Oh, we'll cure the candida. See? Oh, you're allergic to milk. Okay, don't have milk, or we'll desensitize milk. So the solution comes along with the correct diagnosis of the causes, really. And then I've left until last what I think is the #1 way to reduce body burden, and here it is. It's getting rid of allergy foods. Now, I'm not trying to say everything in the world is a food allergy. You know, I'm not trying to say cancer is a food allergy. What I am trying to say is that the #1 quickest, easiest, almost foolproof way to reduce body load is to take things out of your diet. This leads to a great healing principle that I discovered for myself in the 70s. You know, I used to think of nutrition like everybody else does. Nutrition is what are you lacking? You know, what do you need that you're not getting? The #1 healer in nutrition, trust me, is the opposite, is taking away things that are not good. Not putting in things that you need, but taking away things you definitely don't need and shouldn't have. And it's such a quick solution. You know, if a person's psychologically stressed and overloaded, that's not going to be quick to fix. If a person's in a hectic and delirious and destructive or toxic marriage, we sometimes call it, you know, the divorce isn't going to come anytime soon. And in any case might take, you know, years before the person gets through the bitterness. The food allergies, the intolerance foods, you can stop them in an afternoon. I mean, how quick a solution is that? As soon as you know that's the problem, boom, out goes the cause. So it's always a good place to start. And this is what I teach time and again. Always start with this. If the problem doesn't get fixed, then you can go deeper, you can look further, you can come up with other investigations. But really, this is the way to start, and it often solves the problems. 9 times out of 10, I would say, it solves the problem. Not because the problem was a food allergy, but because the problem was body overload, and you're now reducing the body overload intelligently. I hope you got this point. It's one of the absolute fundamental building blocks of the new medicine, the kind of medicine that I teach, and it's what we teach in Diet Wise Academy. Okay, thanks very much for listening to this segment.